This podcast contains the personal stories, opinions and experiences of its speakers rather than those of Breast Cancer Now. Welcome to the Breast Cancer Now podcast, providing support and information to anyone affected by breast cancer. I'm Laura Price and I'm the host of the Breast Cancer Now podcast. I'm a food writer and author, and I live with secondary breast cancer. Today's episode, we have something a little bit different in store for you. This season, we asked all our guests the same question. If you could change one thing in terms of breast cancer diagnosis, treatment and beyond, what would it be? Their answers range from providing better mental health and exercise support to making sure people from all backgrounds have access to the same treatments and resources. We've all heard of patients whose symptoms were initially dismissed by their doctors or who were told they were too young for breast cancer. Claire O'Donnell from Make Seconds Count, a charity that supports people living with secondary breast cancer, wants to live in a world where every person is taken seriously so that late diagnosis of primary or secondary breast cancer is a thing of the past.
I mean, for me, I guess, and this is probably coming from a personal experience, is that I would love for the doctors or the nurses or whoever to maybe just respond when you come with a query necessarily. Like, I had a lot of time where I had to fight to say that, you know, I had this condition and they were telling me it was mastitis for 6 weeks and it wasn't mastitis. You know, I had no kids, I wasn't breastfeeding, but almost I felt I had to fight. And I feel like if I hadn't had to have waited those 8 weeks, my own prognosis may have been different. And I think for secondary breast cancer specifically, there's a lot of ladies that go back to their GPs or go back to their team and say, I've got a bad back, or, you know, I've got a pain. And it's often they're not joining the dots and they're not going, well, this person had breast cancer, why don't we just investigate this? And it takes a long, long time, but by that point it may be too late and you may be, you know, further along in your secondary breast cancer journey as you would need to be. So for me, I would like the patient to be believed a bit more when, you know, or at least investigated, whether that be with a scan or checking your notes and seeing that actually they're not just coming because they've got a sore back, they're coming because they're concerned about something else. So for me personally, I would like that to be a bit more accessible. And obviously lots more research, lots more treatment options.
Yeah,
that would be wonderful.
Absolutely. Fern Maxted and her mum Jan, who were both diagnosed with breast cancer in 2022, would like more awareness of the signs and symptoms, educating people to check themselves and to know that anyone can get breast cancer.
I would love to see when women get their smear tests, obviously we get those at a much younger age, I would really love whoever does the smear test to say, have you checked your boobs lately? Because it's free, it won't cost the NHS anything, it takes seconds, but it brings to the patient that they should be aware of it and that it will dispel any misconceptions that breast cancer only happens to people who are of mammogram age. I think that's something really simple that could be done that would just bring it to the forefront of younger women's minds.
That's a great idea. So in the cervical smear test that is done at people's GPs, just for the nurse to ask, have you checked your boobs lately? Yeah. And maybe a leaflet or something.
Yeah, that's a really good idea.
Jan?
Yeah, I think probably when we are talking about it, just to be really explicit in saying to people, it really could happen to you. You know, because we all hear so many stories or heard so many stories before us that are really heartbreaking. And you think, oh, that's awful. You know, like a friend of mine, her daughter was diagnosed just before COVID. She was 30. And I thought that is just absolutely awful. And I couldn't imagine what it was like for my friend, for her daughter to be diagnosed. You know, but it didn't once cross my mind that could be my daughter. I don't know why, to this day, why I didn't think that. But we just aren't used to thinking, really accepting that could be us. So perhaps much more explicitly, you know, this really could be you.
Yeah.
Make sure that you understand that.
Sonia Gale spoke to us about breast cancer in the workplace. Sonia would like to see artificial intelligence used both for diagnosis and to create personalised treatment plans for patients. I would like to ask you the question that we ask all our guests on the Breast Cancer Now podcast, which is, if you could see one change in diagnosis and treatment of breast cancer in the coming years, what would it be?
Oh, we've seen so many advances, and you obviously want that to continue. I think AI, it can be a wonderful tool. It's not a replacement for a doctor, but it can be a great tool for early diagnosis. I think the holy grail is a simple blood test that can detect cancer in a meaningful way, and then aligning that to a tailored treatment, which is suitable for you and you alone. And that treatment is designed to maximize the best outcomes for you. And I think if we can get to that, then I would say we've probably achieved as a charity what we set out to achieve, which is for everyone, to be diagnosed early, and when they are diagnosed, to live and live well.
Barbara Wilson, who runs the organisation Working with Cancer, wants to see treatments that are milder than the current harsh chemotherapy and that focus more on the patient's quality of life.
Well, ideally, there'd be a cure. I don't think cancer will ever disappear. I think it'll always be part of our lives. But I think what would make a difference is to have treatments that aren't so invasive and difficult to live with. So I think the issue is, how can we make treatment something that people can cope with more easily?
Talking of quality of life, Dr. Sam Orange, a clinical exercise physiologist and researcher at Newcastle University, wants all patients to have access to exercise.
I would like to see physical activity and support and referral to be routinely offered as part of standard follow-up care for women who've had breast cancer and breast cancer treatment. I hope that our project called PureX can provide a feasible and acceptable and scalable model to be able to do that.
Fran Whitfield is a cancer exercise and rehab specialist who was diagnosed with secondary breast cancer when she was just 25. Like Dr. Sam, Fran wants all patients to feel empowered to keep moving their bodies, whatever the stage of their cancer. If one thing could change in terms of breast cancer diagnosis, treatment and beyond in the next few years, what would you like to happen?
When you have that diagnosis and you receive that as part of your information that you get, whether that be from the team or the leaflets that you get and things like that, you have access to an exercise specialist. You have access to your nursing team, your oncologist, you have access to the dietitians in the hospital, physiotherapists, but we don't have enough access to a cancer exercise and rehabilitation specialist. And that's the number one thing that I really want everyone to be able to have access to, or pointed in the right direction, because people don't know that we exist, and people don't know that actually exercise is so important for your treatment, and you can still trust your body when you're going through treatment to be able to do these things and not feel weak and not feel scared to move in certain ways.
When it comes to mental health, Dr. Naz Derakhshan from the Brick Centre wants patients to be given the tools to cope emotionally with breast cancer.
I would like to see that there are more provisions for psychoeducational support and more effective programmes for improving mental health, sustainable solutions, for women, so that they are not buying time to survive, but they're actually thriving. They believe that they can go out there and do it. So the psychological aspects of breast cancer and empowering women, I want to see, happening in a strategic way, not like, in a dotted way. Well, we've got this counselling programme there, and then so-and-so's developed this. We want women to be independent as well. We don't want them to be reliant on constant counselling and constant, psychological treatments. We want to give them the tools that they can independently apply. I know it sounds a bit fairy tale, but it can be done. Psychological support doesn't factor in the cancer care pathway, and it needs to.
Emma Campbell is a podcaster and motivational speaker with secondary breast cancer. She wants to see more stories of people surviving and thriving long term, and to share the message that we can all be limitless. If you could see one change in terms of the diagnosis, treatment, or recording of breast cancer in the coming years, what would it be?
Gosh, I mean, obviously it goes without saying that all treatments and all advances available to all. I mean, that just, that's kind of so obvious. I think more examples of people living in the long term, more of the positive stories, not just within our community, but in the media, and kind of, people being represented, as living with what is more and more a chronic disease for many, rather than a terminal one. That would be a wonderful change, and I think a more deeply rooted belief that life can still continue and be big and full of possibility and expansion, despite what on paper can seem grim.
Dr. Liz O'Riordan, a breast cancer surgeon who was diagnosed with breast cancer herself, wants more funding and research to be put into extending the lives of secondary breast cancer patients.
I think coming off patient choice, I'd like trials to be open to everybody wherever you are, off the back of COVID and all the virtual technology, and more research in metastatic cancer patients. We need more quicker access to drugs, and everyone should be in a trial just to try and help. I think there's too much on prevention. And the biggest risk factors of breast cancer are being a woman and getting older. And I think we need more money to help all of us stay alive for as long as possible.
Krina and Toril run the South Asian Supernovas, supporting women within the South Asian community. Krina wants to see people from all backgrounds in breast cancer messaging, while Toril wants marginalised groups to be included in data and research.
So we need to collect more data, and we need more research, both in primary and secondary breast cancer, but particularly including marginalised groups, including people of colour and different ethnicities, but also other marginalised groups too.
Thank you.
For me, I think it's representation. Representation in media, representation in campaigns, representation in clinical trials, representation in sort of the oncology space overall.
Dan Wills works for the organisation that gives charities like Breast Cancer Now the green tick as trusted information providers. He wants all patients to have access to the right information, allowing them to make informed choices about their own health.
I think something that's really important is that patient choice. You being able to, like you were saying earlier, you'd like to see it from 3 people rather than your team at your hospital. I think that's something that's really important, that people can get access to that information and make a choice that's right for them. Because like Liz was saying, not everybody is the same. You'll have some people that are healthy, some people that are interested in their diet. You'll have others that are like, actually, I know I might only be around for another 5 years, but if I had treatment, my lifestyle is going to change, and I don't want that. But without that good quality information that you can trust, you can't do that. That's something that I'd like to see.
In a similar vein, patient Fiona Stevenson is urging healthcare professionals to listen. She wants doctors to respect our wishes when it comes to our own bodies and our own health. If you could change one thing in terms of breast cancer diagnosis, treatment and beyond in the coming years, what would it be?
Listen to the patients, and for those that want mastectomies, that do not want reconstruction, please, please, please listen to them and listen to their reasons as to why. Do not force us to go through the 3 months counselling to prove we're a sound mind to make that decision. That's degrading. We don't want mental abuse like that. We need to be supported. And that is just my one wish.
Paralympic champion Erin Kennedy is a campaigner for breast cancer awareness and early detection. She wants to encourage patients to have the confidence to ask for what they need in the medical setting.
I think it would be to kind of empower patients to have the confidence to advocate for themselves, to be able to ask questions without time limits, to explore the options that are best for them with healthcare professionals that aren't stretched and have the capacity to listen to them and hopefully act on what they want. And that goes all the way through from early diagnosis through to choice over surgery and things like that. And I think that, kind of encouraging individuals that, you can advocate for your own health and knowing that could be kind of received well as well.
Now for something a little bit different. Hannah Gardner, a secondary breast cancer patient and self-confessed Spice Girls superfan, said she'd like to employ a little bit of girl power. I'm going to reword the question that we ask at the end of this podcast to everyone. If you had the power to change one element of breast cancer diagnosis and treatment within the next few years, what would it be?
Ooh, that's a big one. If I had the power to change one element of it, so just one thing, can I change its existence?
Sure.
Yeah, there.
Absolutely. That's what the Spice Girls would do.
Doesn't exist. There we are. It's gone.
Yeah, I think that might be the best answer we've had to that. Breast Cancer Now's goals are to stop people dying from breast cancer, to support people to live well with the disease, to accelerate detection, and to improve prevention. The charity's vision is that by 2050, everyone diagnosed with breast cancer will not only live, but live well. As for me, I'd like global pharmaceutical companies and scientists to put aside profit and rivalry and work together to find a cure for cancer. We did this with COVID, and yet cancer is the real big C, killing hundreds of thousands of people every single year in the UK alone. If we can show the human face of cancer, that we are people with families and careers and lives and hopes and dreams, then one day, perhaps even in my short lifetime, we will find a cure. Thank you for listening to the Breast Cancer Now podcast, and stay tuned for season 6 coming soon. If you enjoyed this episode of the Breast Cancer Now podcast, make sure to subscribe on Apple Podcasts, Spotify, or wherever you get your podcasts. Please also leave us a rating or review on Apple Podcasts and perhaps recommend it to someone you think would find it helpful. The more people we can reach, the more we can get Breast Cancer Now's vital resources to those who need them. You can find support and information on our website, breastcancernow.org, and you can follow Breast Cancer Now on social media at Breast Cancer Now. All the links mentioned in this episode are listed in the show notes in your podcast app. Thank you for listening to the Breast Cancer Now podcast.